Okay, I'm going to get us started. Good afternoon, everyone. I'm Andrea Starmer. I'm the director of our Foundation Success team here at CHIME, and it's my pleasure to welcome you all to today's webinar, How to Put Enterprise Service Management to Work in Healthcare. We'd like to thank our host firm, Optimum Healthcare, for hosting this webinar, as well as their support of our fall forum coming up in San Diego, as well as all of our CHIME members on today's call. Before we get started, I'll share just a few technical details around housekeeping. If you have difficulty hearing the audio, you can adjust that by clicking on the arrow towards the bottom of your screen next to the microphone and changing your audio options. And we want this session to be interactive. So we're going to be taking questions and comments all throughout the session. I'll keep my eye on both the chat box and the Q&A box and share those with Brian as you submit. So please, as something comes to mind, submit your thoughts in one of those and we'll open up the conversation. At the end of this session, please take a few minutes to complete the evaluation. It should pop up on your screen when I close the session, but I'll also send you an email with the link to that. Now I'm going to hand it over to Brian.
Thanks, Andrea. Good afternoon, everybody. My name is Brian Simmons, Chief Digital Officer and head of our digital transformation business here at Optimum. So just to go a quick background on Optimum, just for context, about a 650-person organization, been around for about 13 years, very specialized in the provider space relative to Epic implementations, life cycle of Epic, activations, go live training. So that sets a lot of context for us with our client base. As well as a lot on the staffing side. We're an elite ServiceNow partner specializing in healthcare, have a cloud practice, have a cybersecurity practice, and a technology transformation business, which is very involved in merger and acquisition integration of acquisitions in the healthcare space. So because of that, we tend to see a lot of transformational efforts and be part of those. So and again, as part of that, we oftentimes see a change to wanting to get more enterprise-centric when it comes to things like service management. And as big transformation efforts come and health systems grow and through acquisition or otherwise or organically, the need becomes more substantial to improve the workflow of our employees, that improve their efficiency, but also to kind of reduce the complexity and surface area of all the different systems and solutions that we have to deal with on a daily basis. So with all that in mind, kind of as background and context, today's conversation really is going to focus on, how do you put enterprise service management into play? Is it really a thing in your organization? Should it be? What are other organizations like yourselves doing in this space today? And how can you get and derive value from it? So kind of gone through the introductions. We'll talk about, conceptually what enterprise service management is, talk a little bit about governance, talking about a platform strategy as well and how that plays. But what does effective governance look like? Things like organizational change management. Who are the key players in enterprise service management and developing and rolling out a strategy? What are the better practices for implementing things like governance? Governance is a critical component to successful enterprise service management, along with change management to some extent. So I think we'll go through those components of it. We'll talk a little bit about ServiceNow as an example, in terms of a solution that can provide a more holistic and kind of more of an integrated approach, which lends itself to this platform discussion we're about to have. And a little bit of background on us, just to talk about, again, contextually, some things we see in the industry today where we see folks that are being successful and getting real value from some of these solutions and components as it relates to an enterprise service management strategy. So to start, I think one of the first places people will look and go is as they look at the organization kind of from the top down, how are they looking in terms of developing a platform-based strategy? Because it really lends itself to an enterprise platform strategy itself. So when you're looking at enterprise service management, are you looking at a myriad of tools? So what you see, kind of on the left side of the screen right now is, are you looking and focusing on those individual best of breed plays from a tooling and kind of application perspective that can address challenges you have around HR workflows and service delivery and management, employee workflow and employee journey, things like onboarding and things like that, where you've got a number of different applications, each one well suited to its specific function, but maybe not providing you the one look and feel and kind of a one approach and one interface. Likewise, other organizations look at it, and we see a lot of this on the electronic medical record side, and to some extent the ERP, where we're seeing larger systems solutions, the oneness of that with solutions like Epic and Cerner, where you're getting a very much a platform-based approach and a strategy that goes along with that says, hey, I'm investing in this enterprise class electronic medical record system that can do a lot of things for us. So keeping things in the context of that platform make a lot of sense. And then ensuring my other solutions provide integrations to that solution. So we're not, again, looking at stovepipe kind of point-based solutions for everything that we do, which doesn't necessarily give us, if we don't have that, it's very much of, I need to go over here for one thing, over here to request something else, over here to find some additional information. And now we start to overwhelm and kind of overload our employees and the folks whose experience we're trying to optimize and create some efficiencies there. So first, we usually start this conversation, and from what we see in the industry today, and this comes from a lot of validation of working with a number of clients over the past almost 15 years now, where we see both sides of the coin. Where if you're looking at a best of breed solution, you see the pros and cons there as well. Of you can get very specialized, very focused on a larger number of systems, a larger number of applications, which require additional training, additional workflow development, additional support, which can drive a larger team, versus to the right where we see, maybe if we can consolidate and kind of move down the stack a little bit. And I would use examples of Epic and Cerner on the EMR side, Workday and Oracle, and potentially in things like Infor and PeopleSoft on the ERP side, and especially some of the newer versions of those solutions provide, the supply chain integration, general ledger, accounting, revenue cycle, finance, and procurement capabilities all in one place, again, with good integration. And then ESM, things like ServiceNow, Avanti has solutions there. There are other players that are emerging that do bring capability, that bring a number of these different functions and facets together into kind of a single platform to help you manage risk from. And then administration and productivity. When we think there, we think in things like the Microsoft stack and other solutions that go into providing us the ability to connect to and collaborate and provide interactivity and communication among our teams and provide a single place to go to get information or to host our information. So from this perspective, this kind of sets the stage for, as you start to look at an enterprise service management strategy, doing it with a best of breed approach in some cases can lead to a lot of complexity, can cause a lot of concern in that it's not necessarily consolidated. It can be very focused on each of those individual areas I just kind of went through in the shared services side, whereby it's not really connected, but we've got a number of solutions that potentially can get the job done. So the next step, and once you kind of determine where you are from a best of breed versus a consolidated approach, governance really matters, right? And governance is also there as part of the process to assist in making those decisions about the tooling, the prioritization, what the value expectations are, what we want to get out of this system from the organizational perspective, what are our goals, developing a shared vision. And this is why it becomes really important as we get into as we start to define enterprise service management. Just by its name, it's larger than just one part of the organization, one department, one part of the shared services pie. So at this point, it's bigger than just say IT. Now we're talking to those other parts of the organization that also have service management expectations and needs and trying to come together to develop a coherent, cohesive strategy, a vision, shared goals. But with that is shared governance, right? And from a governance perspective, as you see from the slide in front of you, these are the things we felt like really were important to identify in terms of what goes into a good governance plan as you are looking to, create the strategy, develop tooling, develop priorities, develop budget, shared values, expectations. How do we measure, right? What are the architectural impacts? What are the infrastructure impacts of these solutions? And really, one of the most critical pieces here, what's the impact of the folks that have to use this system? And are we creating value for them? Are we improving workflow? Are we improving efficiency? Are we making their lives in day-to-day better? And from a healthcare context and perspective, those folks that are caregivers in our organization, really at the end of the day, a lot of this is to support them being more focused on our patients. Because if they spend more time with patients, obviously that has a lot of benefit from a patient safety perspective. It improves their quality of life, improves their experience as employees of our organizations. So they're more apt to have a deeper appreciation for the organization, better experience, better longevity and retention in the organization, which has a number of benefits on top of that as well. So as we see here from the governance perspective, a few things I'll call out as well, right? So there's standardization that comes with governance. So standardization in terms of policies, processes, some structure that goes along with that well. And I would also note that many of our organizations that have kind of implemented, I would say, the more recent electronic health record systems, for instance, the Epics of the world, the Cerners of the world especially, you've already adopted pretty significant governance models when it comes to those solutions, those platforms. They're very complex, they're very large, they're very impactful to the organization, probably the most impactful applications the organization is going to run and support on a day-to-day basis, and they're going to impact so many of the things that we do day-to-day. We tend to have fairly good governance there. Those vendor solutions tend to come with a significant amount of recommendations and advice relative to governance. So some of this already exists, and many of you already know what right looks like. So applying that to these other types of solutions, like an enterprise service management solution, again, where you're going to be making pretty significant investments in terms of staffing, support, licensing, and implementation, training, change management, all of those pieces, it makes an awful lot of sense to make sure you get governance right. Because probably the two biggest areas we see organizations struggle with when it comes to implementing, fairly significant strategies and plans and rolling those out over a period of time, governance and organizational change management are probably the two biggest areas where we see healthcare organizations struggle. They're very good at, most of us are very good at acquiring licensing, understanding the technology, and the technology itself is very sound. It works well. A lot of this stuff works well out of the box even. But it's the governance and organizational change management where over time, a lot of organizations struggle because they don't put these controls in place up front and set an expectation. And going into these types of strategies with all of the necessary shared services departments and parts of the organization already on board, or at least aware of the plan and in agreement with it, and getting that top-down leadership support as well, always helps as well. That to us as well as another key component. So we've kind of hit on this one as well. So starting with alignment, going into the infrastructure and those pieces to say, how do we implement this? How do we support it? And then are we doing the right things for the right reasons, right? Did we prioritize? Are we attacking the right problems that are happening in our organizations today? Why are we doing it? What problems are we trying to solve? And are we prioritizing the right things? Or are we just doing things that maybe each team might think needs to be done, but we're not looking at the organization holistically? So that's a key component as well. When it comes to governance, these, you kind of look at the left side of the screen here, and these are things that we're looking to reduce, right? Reduce risk. reduce noncompliance, reduce inefficiencies, right? These are goals that we have. So ensuring that our governance is effective reduces what's on the left, increases kind of what's on the right, right? Those are the goals we have from a governance perspective. So, as we look to implement an enterprise, a service management strategy, are we doing more on the right, less on the left, right? Those are the things. Reduce left, increase what's on the right. And then if you kind of look in the middle, what we're going for there is, here are the different things that need to be included, right? These are the things that need to be contemplated in terms of developing a governance strategy. And I'll be very honest that in many cases, a lot of organizations start with IT, because let's face it, IT has a significant amount of process. We really are there to serve the user community and ensure and increase their efficiency and support their goals and objectives throughout the organization, regardless of what the business process is. So, in many cases, it starts with IT, but it can't just be IT centric. It can't just be inwardly looking IT. The idea here is you implement these types of strategies, it's really bringing in those other parts of the organization. And, those black bubbles around the center core of effective governance are things we want to make sure we're kind of inspiring and integrating into our governance plan and strategy, right? These are the things, if we're not doing all of these things, communication is critically important. Assessment is critically important. Education and training, if we want adoption. And again, that's where I go back to the EMR. We've done a great job in the industry over the last decade plus of implementing these new solutions and looking at adoption and understanding training and understanding what makes that successful, and how do we get folks to adopt the new technology, the new workflows. Very similar here. So the nice thing is we've got a model that a lot of folks in the industry and a lot of our organizations have been using, that we can duplicate what works well within those governance strategies and plans as well. So getting kind of to the meat of enterprise service management, you can't go anywhere without starting with a definition. So we identify here what Forrester calls enterprise service management. And for the most part, I think it captures the majority of the components that need to be addressed and need to be contemplated and included in developing an enterprise service management strategy for an organization. So if you kind of break it down and look at it, it's beyond IT, first and foremost. It's not just IT. IT maybe is a core, maybe is a starting point, but clearly it goes well beyond. Because let's face it, if you look at the blue boxes down below, as we start to get out of IT, other critical areas come out. HR is a great example of our employee and workforces oftentimes need support with questions about benefits, entitlements, education assistance, questions around payroll, or other time off policies or FMLA policies, or where do I find a form? So in many cases, HR is providing a significant amount of service management support to our employees, because let's face it, if the pay isn't right, if benefits aren't right, it's extremely distracting to our employees and the workforce, and we want to get them answers and get resolution as quickly as possible. Field services management, customer service management is a great example. So you may have other organizations that you support that are not necessarily owned parts of the organization. They're not fully integrated and employed, but maybe they're physician practices or other hospitals that are maybe Community Connect partners if you're an Epic organization, that are key constituents and stakeholders in success, and they're leveraging a system, and honestly, they're your customer. So how do you interact with them, right? Are you using the same systems used internally? Maybe there are other capabilities that you could provide as an extension, but maybe keep that separation and provide something else. And maybe the SLAs are different. Maybe the way we interact is different. And maybe contractually, there's some differences in how we support those parts of the organization. So as you start to look across the board, and I'd also throw things like clinical engineering and biomed is a key component now. And in some cases, they're part of the IT organization today. Some cases, they're not. They're part of facilities, or they're other parts of the organization. Just given the criticality of what they do, But there are support mechanisms there. A pump or vent is malfunctioning or is broken or not available. How do we interact? What solutions and systems do we need to go interact with from a clinician's perspective? Where do I go get help with this device? Is it IT? Is it not? Who do I call? Who do I ask? How do I get this support? Likewise, we have some similar things from a cybersecurity perspective as well. Governance, risk, and compliance could be security operations of, hey, there's an event that's happening, or we see something that's going wrong, or we need some assistance from other parts of the team to go investigate something that seems to be happening in another part of the organization or another system. I would also put facilities in there as well, where maybe there's a light bulb out, or maybe an electronic door is malfunctioning, or some other component, could be the temperature, could be a refrigerator, or could be some other component in the organization that, because it's failing or is becoming a problem, how do I let folks know, hey, we have medications in this refrigerated area. I'm getting an alarm, or I'm seeing a problem, or the power went out in that. Who do I contact? Where do I get help? Without a centralized place to go do all these things, to request this support or help, or to make a request for something new even. Without that, we create just a ton of inefficiency. And that's why in the top right corner, what does right look like, right? So service excellence, right? So we're the ability to get problem solved for the community of people that we support as quickly and efficiently as possible really is the goal. But are we able to measure that? Are there metrics in place? Are there solutions and systems that can measure when a request was made versus when it was resolved and delivered, when something went down or something became unavailable to when it was resolved? Continuously improving is another part of this as well, to say, can we get better? How are we doing today? What is our baseline? Do we know our baseline? In a lot of cases, a lot of these disparate systems, we don't often have the opportunity to see and understand exactly how we're doing. So how do we score ourselves? How do we know if we're successful or not? How do we make that determination, right? So that's a lot of the questions we should be asking, and many times we do. Likewise, that customer experience, that comes through time and again when you start talking about enterprise service management, because most organizations that undertake a dedicated enterprise service management approach are really doing so to address some shortfalls or concerns the organization is having about, hey, it's taking too long to get all of these different items we're talking about, all of our blue boxes and those things like those. It's very confusing and very happenstance about how do you get things taken care of? How do I get my job done? Let's consolidate to one place. Let's bring everything back in. And this brings up the concept of a system of record versus a system of action, right? Our systems of record, our EMRs, our ERPs, our other systems where we're truly, those are our sources of truth. But we've got systems of action, a lot of cases, the service management components that need to integrate and pull information from those solutions to provide the answers and to provide the support needed to get things resolved and or requested in the most efficient manner. So the last piece of this down below, really around process, workflow, and automation, right? So process is key, right? Every one of these areas has a key set of processes, a key set of workflows. How much of that can we automate? When a request is made, do we necessarily have to have a lot of manual intervention, or can we set rules up and understanding what we know the outcomes need to be? We can set up rules in these platforms and solutions such that we can automate, the administration of a request or a resolution of an incident. If we know what the input is, what the output needs to be, and what the outcome needs to be, and this is something that is repeatable, in many cases, we can look to automate some of that stuff as well. So that's some of the more future-looking things. I mean, AI is a component of this. We'll talk about in a moment as well. But the ability to intervene with automation when someone needs support, we don't necessarily have to have a human being on the other side of every one of these interactions. We can have self-service. We can have the ability to automate based on a set of rules that we know hold very true. So that's where we get back into standards and things like that again. Oftentimes, organizations will, as they take a look about how they're going to implement or where they are in the journey, of enterprise service management. In many cases, hey, we do really well with IT. We do pretty well with HR as well, but some of these other areas, maybe not so much. We've been doing things the same way for a decade or more. And it's working, no one's necessarily complaining about it. But do we have that holistic view? Do we have a single platform from which we can have folks interact versus I need to go hunt for the answer. I need to go hunt for a response. I need to go seek out who can help me with this particular problem I'm having. And again, I would use the example of a clinician or nurse on the floor having to go investigate, well, who do I go talk to about this specific issue I'm having? It's impacting, the patient's experience. It's impacting our delivery of care. We need to get this resolved. But in some cases, they're taking an inordinate amount of time to go get answers and maybe referring to their peers or calling the IT service center or help desk for an answer or help with that. And then they get redirected to say, that's not with us. You need to talk to this other part of the organization, or hey, call this team or this group. So now we're pulling that individual away from what they're really meant to be doing, is delivering care, or could be somebody in our finance or supply chain team, pulling them away from their daily duties to go seek out information that really should be at their fingertips. And we should be able to support in a very, very refined and aggressive manner. But as we look at the maturity of where organizations are, I would challenge folks to kind of take a look at this and understand where you as an organization are on this continuum, on this spectrum. In a lot of cases, the lower left is fairly predominant, versus as you kind of go up to the upper right, through aligning and activating. Now you've got multiple shared services department that are active on a platform, that are working together, that have some shared governance and change management in place. They're leveraging, shared process. They look at priorities across the organization, not just within their departments. So it truly is kind of an enterprise-centric way of thinking, and it leads you to, having that very mature aspect of strategy. And the lower right on this slide as well, I think, is very it's valuable information about, what an organization that's truly adopting and integrating, ESM concepts and strategies, those the things on the bottom right where they're getting these things right. They're doing this well. I would really highlight 1 and 2 in that list, because that's kind of it's almost that portal perspective, that employee center that one can look at to say, okay, I just know from an organizational perspective, regardless of my role, if I need something, I want something isn't working or broken, or I need to, I have an idea, let's even call it the ideation piece. If I had one place to go and I knew that was the one place to go every time, it was a clean interface, it was an easy place to go and get to, that is the mark of an organization that's really contemplated the employee experience, that workflow aspect, and is really integrating to that point. Because the solutions that we use today to deliver a lot of this work on the back end integrate, they're the systems of action that integrate with the systems of record. So those integrations happen, and those are the mark of these enterprise class systems, because the APIs and integration are there, so we can provide answers. We don't have to store all the information in multiple places. I can go to the place where I know it is. I can go to that system of record and get that piece of information, but I can deliver it through that interface, through that portal, through that employee center where the organization just knows everybody goes there to go do it. The other component of this from a knowledge management perspective, you see in number 3, that's incredibly important for things like self-service, virtual agents, and the ability to automate support for those tasks and requests and processes that are fairly consistent, maybe higher volume. We can start to take some of those down with some of that automation, as well as the ability to leverage things like AI. So as we all know, AI is coming more and more into a number of different solutions. Every vendor has an AI solution today, but if you're able to kind of build from the model and leverage LLMs and AI and feed it that information and in your own knowledge, for instance, whether they be HR policies, whether they be IT policies or how-tos, whatever information we have and we feed it, if you effectively have knowledge management and effectively manage the knowledge management, which means standardization, consistency, templatization. It's much easier for the systems to kind of absorb that, build it into the solution, and then be able to serve that back up to the user community to, let's face it, let's have the people that used to do that day-to-day interactive, repetitive support. We can then do more of the same and move those folks into doing more higher value add activities, more complex activities, and improve things like our SLAs as we're starting to measure as well. And quite honestly, most organizations, our employees outside of our organizations, whether it's their bank, finance and mortgage companies, cable companies, telephone companies, a lot of the, Amazon, they're used to self-service. They're used to navigating with clean, nice interfaces and being able to get their answers themselves, and don't necessarily always need an active person on the other side of the line as well. And then the CMD is another one I would call out and mention. So configuration management database from an asset perspective, could be clinical assets, could be facility assets, could be IT assets and applications. Those are all things that if we understand where they are and the relative information around each of those, we can start to associate those assets with incidents, with requests. We can trend. We now have, from a cyber perspective, the whole picture of what's in our environment, what do we have on the wire, so to speak, and what's the condition of it? Is it reachable? Is it up to date? Does it need patches or other software? Who supports it? If there's a problem, where is it located? Who are the users that tend to use this equipment? Having all that information really just accelerates responsiveness, but also helps us manage risk more effectively. I am going to go to the next slide. Actually, before I go to the next slide, Andrea, can we go? Can we put question 3? Can you put the poll out to the audience? Just, I'd be really before we get into the next ones. This is a question we often ask in an organization, and depends on the organization, might vary, but this is a question we like to ask. I would love to get your answer on this if you could do me the favor of answering. But who do you believe in your organization should be responsible for kind of developing and managing an ESM strategy? And again, based on the organization, in my experience, the answer certainly can vary, but would love to get everybody's answer.
Hey, they're starting to roll in.
Say again, Andrea?
The responses are starting to roll in. We're about halfway there. Last call to participate in the poll. Oh, I got 2 more. Okay.
Perfect.
And you should be able to see the results now?
I do. I see it. So can everybody see this, or is it just me, Andrea?
I think everyone.
Okay. All right. So here we see, fairly telling that, and again, hopefully it met everybody's expectation, but certainly a shared responsibility, I believe, is the appropriate answer. Just having one part of the organization fully responsible for ESM it's a hard charge. The CDO and CIO in some organizations is tasked with it. And it's interesting, the evolution of the CIO role. Now we're seeing the Chief Digital Information Officer, which really kind of contemplates almost a tighter integration with the other shared services areas and ensuring that those areas have access to and are supported from a workflow, tooling, application, and data perspective. So it does kind of imply that. So while we're at it, Andrea, can we go back to the first question? I'm curious, now that we've had some time talking through enterprise service management, I'd be curious to have the first question answered as well. Sure. I think that's supposed to say in your organization.
Yes.
I think I must have mistyped that. Sorry about it. Mistyped it too. But if y'all could answer that as well. So are you leveraging ESM today? Is this a thing in your organization? Is this discussed, talked about? Is this a concept that is being addressed, or at least being talked about, or a strategy potentially being developed, even if it might be incremental and maybe a phased approach? Or is this, IT is doing IT, clinical engineering is doing clinical, HR is taking care of HR, and everybody's cool with that? Would be interested to get the status of your organizations Is this something that's happening? Is this something you're thinking about doing and or doing? Or is this something that's not on the radar or not a priority?
Hey, results coming up.
Wow, 50-50. Interesting. Interesting.
50-50.
Very interesting. All right. Well, that's good. That's very helpful. So very telling for all of you as well to say it's not necessarily a thing everywhere, and there's a lot left to be done. But also for some organizations, maybe the need's not there. Maybe it's not a burning platform. Maybe it's not a burning issue, whereby things are going fairly well. Each of the different verticals or shared service areas is effectively managing what they do and how they're doing it. So nothing wrong with that either. I am going to move on to the next slide. So using an example here. So I use this because I'm very familiar with it. I've used multiple tool sets as well as I've been an interim chief technology officer with several large health systems for, big transformation efforts, one to 2 year type of efforts where coming in to kind of transform and even build a new health system where before it was, a hospital or two, and we added a number of hospitals to it and created a health system. So we had the opportunity to kind of implement a lot of things that were net new, that weren't necessarily in place before or didn't need to be when they were a standalone hospital. But now we're a health system of 7 hospitals. We need the systemness. We need to make some change. We need some transformation. So one of the tools that I've used successfully in that is something like ServiceNow. And what we have here, and again, you can implement your favorite, enterprise service management solution or even point solutions to this. But along the top, we've got a number of different requirements, and I would call them stakeholders in the service management process. These are all parts of the organizations that interact with and basically create the process to make the enterprise run. Each has its own set of processes. Each has a set of tools and workflow that they use on a daily basis. But having something like an enterprise service management solution in place where you've got the experience layer, meaning I mentioned before talking about the portals and how we interact with these types of tools. This is how these systems are put together. So now we have a number of constituents and stakeholders with unique processes, workflows, requirements, and goals and objectives up top. We've got an experience layer where now from a back-end perspective, I look at the workflow applications, and a lot of those lend themselves to, technology is the IT piece and the asset management piece. Operational excellence is our CMDB. It's potentially, our clinical engineering. It's other pieces around that. It's potentially facilities and those other components, finance and supply chain, source to pay operations, procurement operations, legal service delivery, all those different components where in customer experience is another one where we've got, I mentioned before, our Community Connect partners or provider organizations, ambulatory practices that maybe aren't officially part of the health system, but maybe they are dependent upon delivery of services, applications, other things to the nearby, kind of hub organization. Employee experience, HR. So that's HR service delivery. That's employee workflow. That's the onboarding component of the enterprise as well, which again can't say enough about. Within healthcare, it's probably one of the top 3 needs we often hear discussed and the concern discussed within organizations of the complexity and the lack of visible process and status of the onboarding journey. Let's use the provider example of onboarding a provider, all the things from a credentialing and training, access, devices, office space, contracts that have to come into play. And it could be 20, 25, 35 different discrete tasks that have to happen that we can then track with a system that integrates with the other credentialing systems, with the human capital management system, other things like that. So you've got all these workflow applications in the middle that then provide you that basis to say, hey, even though it's a common platform, it can address the discrete needs, wants, and desires of each of these different key process areas and those stakeholders. And then it's all on one platform, right? So now we're managing risk from really from one platform or solution. It's really helping us manage a significant amount of our risk versus doing it in that decentralized kind of best of breed manner. And then, the advantages of using a core platform like this, right? So why would you implement this? Well, for the things you see down below, right? It's that common database, that common set. And again, I would use the Epics and in some cases, the Cerners of the world and others as other examples where you've done this and we are doing it. Workday, Oracle, Infor, you see the same thing in those larger platforms as well. But the ability to have that integration is a key component here. And why I go back to the system of record versus system of action. Having that ability to have that integration, that interactivity is truly critical. And then security and compliance on top of it. These are SaaS-based solutions, very highly secured, encrypted. Understand we're going to have some PHI or PII in these systems as well. So wanting to make sure we have all of these things integrated and protected as well. But this is kind of gives you a look and feel of what kind of an enterprise service management platform, the key component areas of it look like. And here are just some of the challenges that get addressed, right? So you can start to get some real specifics here about, some of the problems you're trying to solve, right? We talked earlier about governance. And within governance, one of the things we're trying to do is understand where do we see value as an organization? What problems could we solve that if we solve this problem, if we could save time in this team, or if we could reduce the cost to support that team, or if we could shave 30 minutes out of the day per analyst because of specific manual tasks and dual entry they had to do, what would that look like? What would the efficiency upside and uplift look like? And if we had to replicate that across a number of teams, it really starts to add up. So you see a lot of opportunity in what you see on the screen right now of these are typical problems that you'll see in an organization like your own, where you can leverage tools, process, and automation to address it and really measure both the before and then measure the after to determine the value that's truly been realized. So really the messaging here is having that prioritized look at what problems and issues your organization is experiencing and really being consultative to the organization to say, okay, let's talk about prioritization. Let's talk about where we're going to get bang for the buck. Let's talk about value realization. Let's understand the metrics, how we measure, and let's understand the expected success criteria and outcomes we want to meet. And if you put all those into place and then have the tooling in place to support, you can address a lot of these things and actually show real success and real value as an outcome. I know we're kind of starting to run a little bit short on time. So two more things I wanted to show that really, I think, kind of help bring it all home and summarize. And I would argue that if you're answering these things and if you're addressing these items you see on the screen here, really kind of creates the value proposition for you as an organization as you undertake a journey like this. But as I mentioned several times before, really it's understanding what problems you're trying to solve, right? What are those issues that we're having in terms of how quickly it's taking to resolve an issue or to request and get an item that's required? How complex is the process to go through that and get that? And are we measuring it? And if we are, and it's taking too long, what is an improvement in that time? If you cut it in half, what does that mean? Like, what is the value that's been created there? Success criteria is also critically important. Like, making these types of investments is not for the faint of heart. These are not necessarily inexpensive systems. These are enterprise class systems. From a licensing, implementation, and ongoing support perspective, they need to be managed. There needs to be a staff. There needs to be a dedicated group of people that live and breathe every day, helping to manage and enhance this platform and continue to address the issues that have been prioritized and handed over to the team to say, hey, here's the next problem we're going to solve. Let's get on it. Governance, again, mentioned earlier in the webinar as well. Governance and organizational change management are probably the two biggest areas that organizations within the healthcare market where they struggle with these types of solutions and these types of strategies. So having great governance and really understanding organizational change management and adoption and learning some of the lessons we've learned implementing these larger electronic medical record and ERP systems can go an awful long way. And then phasing things out, right? You can't do it all at once. You can't boil the ocean. Understanding where the highest impact and highest value are going to be, or where we're able to address the most risk in some cases, is where it takes us first. One thing we're also seeing here from an ESM, kind of a multi-departmental capability perspective. In the past, we might see a multi-phase, let's say a 2 to 3 year program to implement a number of these solutions. Nowadays, we're seeing folks that want to get to value faster. They are licensing fairly heavy, and then coming in with a multi-first phase of a kind of a multi-module, multi-capability, multi-departmental implementation to get to value faster versus waiting maybe 2 or 3 years to build up the solution. It's like we want to have as much of that solution as possible available on day one as we do our OCM, as we do our adoption and our change and our cutover. We want to have a fully functional and a value creating system from day one. So that's been a change. I'd say in the last 18 months, we've seen a lot more of that happen. So getting more done faster on the platform and bringing in some help to do that. And then finally, advancing to new levels of maturity, right? This is education and training from the vendor, which in a lot of cases, these vendors do provide a significant amount of training and have that available either in non-real time or in real time. Instructor-led training, partners in the ecosystem, whichever solution you're looking at. Typically, there are a handful of partners that are out there that specialize in the area you're looking for, as well as within your organization. So training and development of these teams, these types of systems and platforms nowadays from an application support perspective with developers, architects, business process consultants, engagement management leads, your PMs that specialize in these platforms. You have to invest, right? You have to invest in their training, their development, and support them. It's a very competitive environment out there for these types of skills these days. So really investing in the team and your platform makes an awful lot of sense. And that's also having that architect role of somebody who really understands the platform and what the art of the possible is. I also, things like the impact part of the organization at ServiceNow or Avanti and others, other solution providers have as well. Of the teams that help you with adoption, help you with governance, and help you with some of those key pieces of how do I continue to leverage this platform? How do I grow? And partners like ourselves, where we have, we only work in the healthcare space. All of our customers are like you, and they've implemented these types of solutions. So we can share those experiences and case studies and those success stories to say, well, who's getting value from some of these asset management capabilities? Who's getting value from the new AI capabilities? Can you show us some examples? Can you show us some case studies? So you've got a community of folks, both internally, externally, vendors, partners, and others, as well as user groups. A lot of these solutions have user groups in your metro areas that you can leverage to go find some shared experiences and interact with your peers and share ideas of what's working and what's not. My final slide is, as a lot of folks are doing well in IT, typically, and IT is fairly used to implementing and supporting these types of solutions. But as you start to want to gravitate towards the enterprise service management aspect of a strategy and get out of just IT, how do you go about it, right? What's the best route? And I would propose, here's a kind of a 3-step process for what we've seen be successful for organizations that are doing this well and growing outside of IT. How are you finding the other shared services and business unit areas getting interested in and willing to co-invest and co-build these platforms out together? Not governance notwithstanding, obviously that's a key component to this, but these are some things you can think about in terms of understanding, again, I would use HR, use clinical engineering, use facilities, use finance and procurement, other organizations that potentially could benefit from these kinds of platforms. To some extent, you're trying to sell the value of this because, having this core platform makes a lot of sense. A shared platform makes a lot of sense, but they need to buy in. They need to see value. They need to see that these solutions can help them address some of the problems they have. But also they understand their workflow better than anybody else, than other folks that are not in their business unit or understand their workflow ever will. So they understand what their problems are probably best, but helping facilitate, this discovery process of, how could you get value? Here's how we're getting value. Here's some other organizations are doing it. Again, that's where impact and folks like us and other peers out there can help you address some of this. But then, now that you understand, what the issues they're having are, what their concerns are, helping them tell the story, right? And again, using your own experiences, maybe it's within IT or other parts of the organization. Nothing better than telling the story around that and helping them tell their own story, but also establishing those key metrics, right? So what moves the needle? What's important to them? Is it increased patient revenue? Is it decreasing some sort of a security risk or something like that? Is it reducing reliance on a certain skill set that's hard to recruit and maintain, and being able to automate some of those things? So really understanding what the possibility looks like and really supporting their ability to tell the story and build a case. And really, this is about building a business case and having return on investment here to say, okay, there's an investment from a licensing perspective. There's going to be an investment from an implementation and support perspective, but what's the upside, right? And is the juice worth the squeeze? And then finally, as you empower these other parts of the organization and trying to help them get them on board, but also help them realize what that art of the possible is, really help them identify all the potential pitfalls, understand what the potential risks are, and really clearly define that roadmap and what it looks like. And again, the good news is, as others that have gone before you that have been very successful in each of these different areas that we're talking about and putting ESM together. So if it's something of interest, having those folks speak to their own piece, but then bringing everybody together in the collective whole makes a lot of sense. And could be very impactful. Again, depending on the organization, depending on the culture of the organization, it could be a fit. And if so, these are some things to think about when it comes to that. So I'm going to pause there, Andrea, and see any questions. Andrea?
Sorry, thought I was off mute.
I'm like, is this thing on? Have I been talking to nothing for the last 30 minutes?
No. There are no questions in the Q&A or the chat right now, probably because you're so thorough. So, if you have anything that you want to wrap up with, we can just go with that.
Yeah, I'd say, kind of just to start to wrap this up. And as we saw from the survey, right? So, for about half the organizations represented on in the session today, this isn't necessarily something that's in place yet. And maybe it's purposeful, and maybe it's because it doesn't have an owner, or because the value proposition isn't clear, and or folks aren't looking to make that investment at this point, because let's face it, it truly is an investment, and it does require a lot of work to develop the ROI in a business case as you start to make these investments, consolidate applications and rationalize other software. Sometimes folks see it as kind of a loss of control. And maybe I'm ceding control to somebody else. And if I don't control it, I don't own it anymore. I'm going to lose control, and that's going to have an impact on our ability to deliver services. So sometimes that culture is there, and it can be fairly persistent. And again, if conceptually, if things don't seem to be going poorly, or there doesn't seem to be a concern with employee workflows and how we're getting business done, then there may not be a case for change at this point. But I think part of the objective of this discussion was, from a trend perspective, we're starting to see more organizations that are starting to really address the possibility of implementing more of an enterprise service management approach and the advantages it can provide. And now some of the tooling and some of these solutions are in place and available in the market. And we're seeing real success with true ROI, real value being created, reduction of inefficiencies, reduction of repetitive labor, reduction in headcount in certain roles, and allowing you to invest in other roles that you needed even more. So it's not doing more with less, it's doing more with the same. So we're seeing real value there. So that was part of the talk track here today was, this is definitely something that's compelling for some. And I think as time goes on, will probably become a more compelling conversation for organizations. So something to think about. And thanks for allowing us to share, Andrea, and the CHIME organization. We appreciate that. Appreciate the sponsorship and the partnership we have. But any questions? Hope to see you all at the fall CHIME event out in San Diego. If you see me around, feel free to grab me, ask me anything you'd like to there. But would love to interact about it. And again, appreciate the time and your attention.
Thanks so much, Brian. We have one question
Oh,
that
boy.
just says thank you from Seppi. And I agree. Thank you so much.
My pleasure.
This was great. I think that last slide was probably my favorite because it made me do a lot of thinking, just even in my own instance. We appreciate your support of CHIME, and we will see you at Fall Forum. Have a
Sounds
great day,
great.
everyone.
Thanks again.
Thanks.
Yep. Bye-bye now.